Do you want to successfully complete the C810 Objective Assessment Exam? Then you're in the right place. Our website provides a list of questions and answers for your success in the C810 OA exam for free. We understand that acing your OA exam can be quite challenging. That's why we provide completely free exam guides and practice questions for you. In this video, we will cover questions from data governance, health records, data quality, security compliance, and data storage. So let's get started. 1. A hospital experiences a system breach and needs to demonstrate consistent response procedures to regulators, while the Chief Information Officer coordinates the recovery efforts across departments. Which information governance principle best describes this scenario? A. Transparency. B. Protection. C. Accountability. D. Integrity. Can you guess the answer? Correct answer, C. Accountability. Explanation. Option C is correct because accountability involves senior leadership, overseeing programs and taking responsibility for coordinating responses to incidents like breaches across the organization. Option A is incorrect because transparency relates to documenting and disclosing data practices openly, not managing incident response leadership. Option B is incorrect because protection focuses on safeguarding information from breaches before they occur, not coordinating responses afterward. Option D is incorrect because integrity ensures data authenticity and reliability, not organizational leadership during crisis management situations. Let's dive into understanding information governance principles in healthcare data management. When a hospital experiences a system breach and the Chief Information Officer coordinates recovery efforts across departments while demonstrating consistent response procedures to regulators, we're seeing the principle of accountability in action. Accountability means senior leadership takes responsibility for overseeing programs and coordinating responses during critical incidents. It's not transparency, which involves documenting processes openly, or a protection, which focuses on preventing breaches beforehand. The key here is that accountability ensures someone at the top directs actions and makes decisions when things go wrong. This principle establishes clear leadership responsibility during crisis management, making sure there's always someone in charge who can coordinate the organizational response effectively. 2. When a healthcare facility implements new data definitions for their master patient index, while ensuring all departments understand the standardized terminology being used across systems, which principle applies here? A. Compliance. B. Retention. C. Protection. D. Transparency. Do you know the answer? Correct answer, D. Transparency. Explanation. Option D is correct because transparency requires organizations to document processes and activities in an open, verifiable manner, including standardized definitions across departments. Option A is incorrect because compliance involves following laws and regulations, not establishing internal documentation standards for terminology clarity. Option B is incorrect because retention addresses how long data is kept, not how data definitions are communicated organization-wide. Option C is incorrect because protection focuses on security measures to prevent breaches, not on establishing clear data definitions. Now let's explore what happens when healthcare facilities implement standardized data definitions. When a facility creates new data definitions for their master patient index and ensures all departments understand the standardized terminology across systems, they're demonstrating the principle of transparency. Transparency requires organizations to document their processes and activities in an open, verifiable manner that everyone can understand. This means making data definitions clear and accessible to all stakeholders, not hiding them or keeping them ambiguous. It's different from compliance, which focuses on following regulations, or retention, which addresses how long data is kept. Transparency ensures everyone speaks the same language when it comes to data, creating shared understanding across the entire organization through clear, open documentation of definitions. 3. A physician documents patient symptoms during an examination using free text notes in the electronic health record rather than selecting from predefined drop-down menus. What type of data is being created? A. Structured data. B. Metadata. C. Unstructured data. D. Aggregate data. Can you guess the answer? Correct answer, C. Unstructured data. Explanation: option C is correct because unstructured data includes free text entries and narrative documentation that doesn't follow a predefined format or structure. Option A is incorrect because structured data follows predetermined formats like drop-down menus or coded entries in systems. Option B is incorrect because metadata describes information about data such as timestamps or user identification, not clinical content. Option D is incorrect because aggregate data represents grouped information about populations without identifying individual patients or records. Understanding different data types is crucial for healthcare documentation systems. When a physician documents patient symptoms using free text notes in the electronic health record instead of selecting from predefined drop-down menus, they're creating unstructured data. Unstructured data includes any freeform text, handwritten notes, or narrative documentation that doesn't follow a predetermined format or template. This is completely different from structured data, which uses checkboxes, drop-down menus, or coded entries that follow strict formats. Unstructured data gives physicians the flexibility to describe symptoms in their own words, capturing nuanced clinical observations. However, this flexibility comes with a trade-off because unstructured data is much harder to analyze systematically compared to structured data that computers can easily process and aggregate. 4. During a disaster, a hospital must relocate critical patient information systems to an alternate site to maintain continuity of care operations. Which plan should guide this process? A. Disaster recovery plan. B. Privacy rule. C. Risk analysis. D. Retention schedule. Do you know the answer? Correct answer, A. Disaster recovery plan. Explanation: option A is correct because a disaster recovery plan provides structured approaches for resuming work after unplanned incidents, including relocating systems to alternate sites. Option B is incorrect because the privacy rule governs protected health information disclosure, not disaster response procedures for systems. Option C is incorrect because risk analysis identifies potential vulnerabilities to information, not procedures for system relocation during disasters. Option D is incorrect because retention schedules determine how long records are kept, not emergency response procedures for disasters. Let's examine what guides healthcare facilities during disaster recovery situations. When a hospital must relocate critical patient information systems to an alternate site during a disaster to maintain continuity of care, they need specific guidance from their disaster recovery plan. This plan provides structured approaches for resuming work after unplanned incidents like floods, fires, or cyber attacks. The disaster recovery plan details exactly how to relocate systems, what priorities to follow, which alternate sites to use, and who is responsible for each step. It's not about privacy rules or risk analysis, which serve different purposes in healthcare operations. The disaster recovery plan is your roadmap for maintaining operations when normal systems are compromised, ensuring patient care continues even when primary facilities are unavailable. 5. An emergency physician needs immediate access to a patient's medication history, but the record shows as unavailable in the system during a critical treatment decision. Which data quality characteristic is compromised? A. precision, B, accessibility, C, currency, D, definition. Can you guess the answer? Correct answer, B, accessibility. Explanation. Option B is correct because accessibility means data should be easily obtainable and available when needed, especially critical for emergency medical situations requiring immediate information. Option A is incorrect because precision relates to numerical exactness in measurements, not the availability of medical records when needed. Option C is incorrect because currency refers to how up-to-date information is, not whether it can be accessed when required. Option D is incorrect because definition provides clear meanings for data elements, not the ability to retrieve information promptly. Picture this critical scenario in emergency medicine that highlights data quality issues. An emergency physician needs immediate access to a patient's medication history for a critical treatment decision, but the record shows as unavailable in the system. This situation demonstrates a failure of accessibility, which means data should be easily obtainable and available when needed. In emergency situations, accessibility becomes literally life-saving because seconds count in critical care decisions. When records are unavailable at the point of care, even if they're accurate and current, they become useless to the treating physician. Accessibility ensures authorized users can retrieve essential information exactly when clinical decisions must be made, making it one of the most critical data quality characteristics in healthcare. 6. A health information manager discovers that 3% of discharge summaries were completed more than 30 days after patient discharge during a recent audit. Which quality characteristic needs improvement? A. Comprehensiveness, B. Consistency, C. Accuracy, D. Timeliness. Do you know the answer? Correct answer, D. Timeliness. Explanation. Option D is correct because timeliness requires documentation to be completed within specified timeframes, and discharge summaries exceeding 30-day completion violate this standard. Option A is incorrect because comprehensiveness ensures all required data elements are included, not when they are documented or completed. Option B is incorrect because consistency means data remains the same across systems, not related to completion deadlines for documentation. Option C is incorrect because accuracy refers to error-free data that correctly reflects facts, not meeting documentation timeline requirements. Quality audits reveal important insights about documentation practices in healthcare facilities. When a health information manager discovers that 3% of discharge summaries were completed more than 30 days after patient discharge, we're identifying a specific quality issue with timeliness. Timeliness requires documentation to be completed within specified timeframes, and discharge summaries must be done within 30 days, according to regulations. When documentation is late, it affects billing cycles, continuity of care for follow-up providers, and regulatory compliance with accreditation standards. The issue isn't whether summaries are comprehensive or accurate, it's about meeting deadlines that have been established for good reasons. Healthcare has strict timelines because delayed documentation can impact patient care, reimbursement processing, and create legal vulnerabilities for the organisation. 7. When implementing a new disease registry, the Health Information Director writes detailed descriptions of each data element to ensure consistent understanding across all users. What role is being performed? A. Data production, B. Data steward, C. Data usage, D. Subject matter. Can you guess the answer? Correct answer, B. Data steward. Explanation. Option B is correct because data stewards are responsible for developing data definitions and models, ensuring consistent understanding and use across the organisation. Option A is incorrect because data production involves creating or generating data, not defining how data elements should be understood. Option C is incorrect because data usage refers to how information is applied or utilized, not establishing definitions for consistency. Option D is incorrect because subject matter expertise provides content knowledge, but data stewardship specifically involves defining data elements. Let's explore the crucial role of data stewardship in healthcare information management. When implementing a new disease registry, the Health Information Director writes detailed descriptions of each data element to ensure consistent understanding across all users, acting as a data stewards. Data stewards are responsible for developing data definitions and models that everyone in the organization can understand and use consistently. They ensure everyone interprets data the same way by creating clear, standardized definitions that eliminate ambiguity and confusion. This isn't just about producing data or using it. It's about establishing the foundational understanding of what each piece of data represents. Without data stewards, the same data element might mean different things to different departments, leading to errors and miscommunication that can affect patient care. 8. A medical facility stores all patient health information from multiple departments in one central database that all authorized providers can access. Which model does this represent? A. Federated model. B. Decentralized model. C. Centralized model. D. Hybrid model. Do you know the answer? Correct answer, C. Centralized model. Explanation. Option C is correct because a centralized model stores all data in one shared repository where authorized users access information from a single location. Option A is incorrect because federated models use record locator services to find data stored across multiple separate systems or locations. Option B is incorrect because decentralized models keep data distributed across different systems without a central repository for storage. Option D is incorrect because hybrid models combine centralized storage for some data, while other information remains distributed across systems. Understanding health information exchange models is essential for modern healthcare delivery systems. When a medical facility stores all patient health information from multiple departments in one central database that all authorized providers can access, they're using a centralized model. This centralized model means all data resides in one shared repository, like a library where all books are in one building. Everyone goes to the same place for information, which differs from federated or hybrid models where data stays distributed across multiple locations. The centralized approach offers consistency, quick access times, and simplified management of the data infrastructure. However, it also means all eggs are in one basket, creating a single point of failure. The key advantage is providers always know exactly where to find complete patient information. 9. During patient registration, incorrect insurance information leads to claim denials, affecting the facility's reimbursement timeline and requiring staff to reprocess claims. Which aspect is most impacted? A. Clinical outcomes. B. Revenue cycle. C. Quality measures. D. Patient safety. Can you guess the answer? Correct answer, B. Revenue cycle. Explanation. Option B is correct because revenue cycle encompasses the financial processes from registration through payment, and registration errors directly cause billing denials and delays. Option A is incorrect because clinical outcomes relate to patient health results from treatment, not administrative billing and registration processes. Option C is incorrect because quality measures assess care effectiveness and safety, not the financial processing of insurance claims. Option D is incorrect because patient safety involves preventing medical errors and harm, not insurance verification and billing accuracy. Revenue cycle management is a critical process that starts at patient registration. When incorrect insurance information is entered during registration, It leads to claim denials, affecting the facility's reimbursement timeline and requiring staff to reprocess claims, directly impacting the revenue cycle. The revenue cycle encompasses all financial processes from registration through final payment, forming the financial lifeline of healthcare operations. Registration errors create a domino effect, where denied claims mean delayed payments, increased administrative work, and cash flow problems for the organisation. This isn't just about billing departments, it's about the entire financial health of the healthcare facility. Every registration error costs time and money to fix, making accurate front-end processes essential for maintaining healthy revenue cycles and organisational financial stability. 10. Which document must be completed within 24 hours of admission, according to Centers for Medicare and Medicaid Services requirements for acute care facilities? A. Discharge summary. B. Consent form. C. Progress notes. D. History and physical. Do you know the answer? Correct answer, D. History and physical. Explanation: option D is correct because CMS conditions of participation require the history and physical examination to be documented within 24 hours after admission. Option A is incorrect because discharge summaries are completed at the end of hospitalisation, with up to 30 days allowed post-discharge. Option B is incorrect because consent forms are obtained before procedures or treatment, not within a specific post-admission timeframe requirement. Option C is incorrect because progress notes are ongoing documentation throughout the stay, without a specific 24-hour completion requirement. Time-sensitive documentation requirements are crucial for healthcare compliance with regulatory standards. Centers for Medicare and Medicaid Services requires the history and physical examination to be documented within 24 hours after admission to acute care facilities. This strict timeline isn't arbitrary. The history and physical provides the clinical foundation for the entire hospital stay and guides initial treatment. It captures the patient's condition at admission, establishes the baseline for measuring progress, and informs all subsequent care decisions made by the healthcare team. Unlike discharge summaries that have 30 days for completion, or consent forms with variable timing, the H&P has this tight 24-hour window. Missing this deadline can affect reimbursement, accreditation status, and most importantly, compromise the quality of patient care coordination. 11. A nurse documents medication administration, including drug name, dosage, route, and time given for a hospitalized patient receiving oral antibiotics. Where should this be recorded? A. Progress notes. B. Nursing flow sheet. C. Medication administration record. D. Discharge summary. Can you guess the answer? Correct answer, C. Medication administration record. Explanation: option C is correct because the medication administration record specifically documents all medications given, including dosage, route, time, and related administration details for patients. Option A is incorrect because progress notes document overall patient condition and treatment response, not specific medication, administration details and times. Option B is incorrect because nursing flow sheets track vital signs and assessments, not the detailed medication administration, information and timing. Option D is incorrect because discharge summaries provide overall stay information at discharge, not real-time medication, administration documentation during hospitalization. Medication documentation requires precision and specific recording locations in healthcare facilities. When a nurse documents medication administration, including drug name, dosage, route, and time for a hospitalized patient receiving oral antibiotics, this information goes in the medication administration record. The medication administration record, commonly called the MR, is specifically designed to capture every detail about medications given to patients. It records what drug was given, how much, by which route, and exactly when, creating a complete medication history during the stay. This isn't recorded in progress notes or nursing flow sheets, which serve different documentation purposes in patient care. The MA helps prevent medication errors, ensures continuity when shifts change, and provides crucial information for medication reconciliation at discharge. 12. When a healthcare organisation implements processes to meet regulatory requirements while standardising data governance language across all departments, which information governance principle is demonstrated? A. Compliance. B. Availability. C. Disposition. D. Retention. Do you know the answer? Correct answer, A. Compliance. Explanation. Option A is correct because compliance ensures the information governance programme meets applicable laws, regulations, standards, and organisational policies throughout the system. Option B is incorrect because availability focuses on maintaining information for timely retrieval, not meeting regulatory requirements and standards. Option C is incorrect because disposition addresses secure destruction of records no longer needed, not regulatory compliance and standardisation. Option D is incorrect because retention determines how long information is maintained, not adherence to regulations and governance standards. Information governance principles guide how healthcare organisations manage their data responsibilities effectively. When an organisation implements processes to meet regulatory requirements while standardising data governance language across all departments, they're demonstrating the principle of compliance. Compliance ensures the information governance programme meets all applicable laws, regulations, standards, and organisational policies consistently. This isn't just about following rules, it's about creating systematic approaches to meet all requirements, including HIPAA, state laws, and accreditation standards. Every department must align with these requirements using standardised language and processes to ensure consistency across the organisation. Compliance creates the essential framework ensuring all data handling meets legal and regulatory expectations, protecting both the organisation and the patients it serves from potential violations. 13. A patient's emergency department record contains both checkboxes for standardised assessments and a physician's handwritten narrative description of the presenting complaint. This represents which data combination? A. Only structured data. B. Only unstructured data. C. Primary and secondary. D. Structured and unstructured. Can you guess the answer? Correct answer, D. Structured and unstructured. Explanation. Option D is correct because the record contains both structured data from checkboxes and unstructured data from handwritten narratives, representing a hybrid approach. Option A is incorrect because the handwritten narrative portion represents unstructured data, so it is not only structured data. Option B is incorrect because the checkbox assessments represent structured data, so the record contains more than just unstructured elements. Option C is incorrect because primary and secondary refer to data sources and uses, not the format structure of documentation. Healthcare documentation often combines different data formats to create comprehensive patient records. When an emergency department record contains both checkboxes for standardised assessments and a physician's handwritten narrative description of the presenting complaint, it represents structured and unstructured data together. The checkboxes provide structured data that's standardised, easily analysable, and searchable in electronic systems. Meanwhile, the handwritten narrative offers unstructured data that's flexible and detailed, but harder to analyse systematically using computers. Most modern healthcare records use this hybrid approach to capture both standardised metrics and nuanced clinical observations. Neither format alone tells the complete story. Structured data provides consistency, while unstructured data captures the full clinical picture. Together they create rich, comprehensive documentation serving multiple purposes in patient care. 14. Healthcare facilities must report cancer diagnoses to state registries, which then submit data to national organisations for developing survival statistics. Which principle governs this requirement? A. Transparency. B. Compliance. C. Accountability. D. Protection. Do you know the answer? Correct answer, B. Compliance. Explanation: option B is correct because compliance involves following mandated reporting requirements from regulatory bodies, including cancer registry, reporting to state and national organisations. Option A is incorrect because transparency involves open documentation of processes, not mandatory reporting to external regulatory agencies and registries. Option C is incorrect because accountability addresses leadership oversight of programs, not fulfilling external reporting requirements to government agencies. Option D is incorrect because protection focuses on safeguarding information from unauthorised access, not mandatory disease reporting to registries. Mandatory disease reporting illustrates how healthcare facilities must meet external regulatory requirements. When facilities report cancer diagnoses to state registries, which then submit data to national organisations for developing survival statistics, they're demonstrating compliance with legal requirements. This compliance involves following mandated reporting requirements from regulatory bodies, not optional internal processes or voluntary transparency initiatives. Cancer registry reporting is required by law for public health surveillance, helping track disease patterns and treatment outcomes nationally. Facilities must comply with specific data standards, strict timelines, and exact formats specified by regulatory agencies. This ensures healthcare organisations fulfil their legal obligations to report notifiable diseases, contributing to public health monitoring, and research that benefits entire populations through improved understanding of disease patterns. 15. After conducting a risk analysis, a hospital identifies vulnerabilities in their electronic health record system and must decide whether to implement new security controls. What is this process called? A. Risk mitigation. B. Data governance. C. Quality management. D. Disaster planning. Can you guess the answer? Correct answer, A. Risk mitigation. Explanation: option A is correct because risk mitigation involves taking actions to reduce identified vulnerabilities and threats after conducting risk analysis of information systems. Option B is incorrect because data governance establishes overall data management policies, not specific responses to identified security vulnerabilities found. Option C is incorrect because quality management focuses on data accuracy and completeness, not addressing security vulnerabilities in electronic systems. Option D is incorrect because disaster planning prepares for emergency events, not implementing controls to address identified system security risks. Risk management is essential for protecting healthcare information systems from potential threats. After conducting a risk analysis and identifying vulnerabilities in their electronic health record system, a hospital must decide whether to implement new security controls through risk mitigation. Risk mitigation involves taking concrete actions to reduce identified vulnerabilities and threats like reinforcing weak points in a fortress. Once vulnerabilities are identified through analysis, mitigation means implementing specific controls to address them systematically. This might include stronger password requirements, data encryption, access restrictions, or system monitoring enhancements. Risk mitigation isn't about identifying risks or planning for disasters. It's about taking preventive steps to reduce the likelihood or impact of security incidents. These proactive measures protect patient information and maintain system integrity before breaches can occur. 16. A physician group connects to a regional health information exchange to access patient records from other area hospitals for coordinated care delivery. Which model facilitates this? A. Personal health record. B. Patient portal. C. Health information exchange. D. Practice management system. Do you know the answer? Correct answer, C. Health information exchange. Explanation. Option C is correct because health information exchanges enable multiple healthcare organizations to share patient information electronically for coordinated care across facilities. Option A is incorrect because personal health records are maintained by patients themselves, not systems for provider-to-provider information sharing. Option B is incorrect because patient portals give patients access to their own records, not to provider access to multi-facility records. Option D is incorrect because practice management systems handle administrative and financial functions within single practices, not regional data sharing. Modern healthcare relies on interconnected information systems to deliver coordinated patient care. When a physician group connects to a regional health information exchange to access patient records from other area hospitals, they're using a health information exchange or HE. This technology enables multiple healthcare organizations to share patient information electronically, like a medical information highway connecting different facilities. Unlike patient portals that serve individual patients or personal health records maintained by patients themselves, HIE specifically connect providers to providers. This isn't a practice management system for billing, it's designed for inter-organizational clinical data sharing. HIs ensure providers have access to complete patient information regardless of where care was delivered, preventing duplicate tests and improving care coordination across the healthcare continuum. 17. When paper medical records sustain water damage during flooding, which recovery method best preserves the information while preventing mold growth and deterioration? A. Direct air circulation. B. Freeze-drying process. C. Chemical treatment. D. Digital scanning only. Can you guess the answer? Correct answer, B. Freeze-drying process. Explanation. Option B is correct because freeze-drying effectively removes moisture from water-damaged paper records while preventing mold growth and preserving the document integrity for recovery. Option A is incorrect because direct air circulation can cause pages to stick together and potentially destroy records rather than preserve them. Option C is incorrect because chemical treatments may damage paper and ink, making records illegible rather than preserving the information. Option D is incorrect because scanning requires dry, intact documents first, and wet records must be preserved before digitization attempts. Disaster recovery for paper records requires specialized knowledge to preserve vital healthcare information. When paper medical records sustain water damage during flooding, the freeze-drying process is the best method for preserving information while preventing mold growth and deterioration. This technique freezes the water in documents, then sublimates it directly from ice to vapor, bypassing the liquid phase entirely. This process prevents pages from sticking together, stops mold growth, and preserves the ink and paper integrity. Direct air circulation would cause pages to wrinkle and stick, potentially destroying the records completely. Chemical treatments might damage the ink or paper, making documents illegible and unusable. Freeze-drying has successfully saved countless historical documents and medical records, making it the gold standard for water-damaged paper recovery in healthcare facilities. 18. A trauma registrar enters patient injury data while ensuring automatic format checks verify that required fields are completed before submission. Which data stewardship principle applies? A. Establishing controls. B. Assigning accountability. C. Creating policies. D. Defining ownership. Do you know the answer? Correct answer, A. Establishing controls. Explanation. Option A is correct because establishing controls includes implementing automatic checks and validation rules to ensure data quality and completeness during entry processes. Option B is incorrect because assigning accountability designates responsible parties for data management, not implementing technical validation checks in systems. Option C is incorrect because creating policies sets organizational rules, while this scenario describes technical controls enforcing data entry standards. Option D is incorrect because defining ownership determines who has authority over data, not implementing format checks and validation rules. Data quality controls are essential for maintaining accurate healthcare registries and databases. When a trauma registrar enters patient injury data, and automatic format checks verify that required fields are completed before submission. This demonstrates establishing controls in data stewardship. These automatic validation checks act as quality gates, preventing incomplete or incorrectly formatted data from entering the registry system. Think of it like having a vigilant guard checking every piece of information before it enters the database vaults. This isn't about assigning accountability to people or creating written policies. It's about implementing technical controls that enforce data quality standards automatically. These controls ensure data consistency and completeness without relying solely on human vigilance, reducing errors, and maintaining registry integrity for research and quality improvement purposes. 19. During a system outage, staff use paper forms to document patient care, then must enter this information into the electronic system once restored. What is this priority action called? A. Data migration. B. System validation. C. Back entry process. D. Record reconciliation. Can you guess the answer? Correct answer, C. Back entry process. Explanation. Option C is correct because back entry involves retrospectively entering paper documentation into electronic systems after downtime to maintain complete electronic health records. Option A is incorrect because data migration transfers information between different systems permanently, not entering temporary paper documentation after outages. Option B is incorrect because system validation verifies system functionality and accuracy, not the process of entering paper-based downtime documentation. Option D is incorrect because record reconciliation compares different record versions for consistency, not entering paper forms into electronic systems. System downtimes create unique documentation challenges that healthcare facilities must address systematically. During a system outage, staff use paper forms to document patient care, then must enter this information into the electronic system once restored through the back entry process. This back entry process involves retrospectively entering all paper documentation into electronic systems after downtime to maintain complete records. It's essential for ensuring no information is lost during outages and maintaining the integrity of the electronic health record. Staff must carefully transcribe every paper form, note and order created during downtime into the appropriate electronic fields. This isn't data migration between systems or system validation testing. It's specifically about capturing downtime documentation electronically. The back entry process ensures continuity of the electronic record despite temporary system failures that could otherwise create dangerous gaps. 20. Which professional is responsible for ensuring documentation errors in health records are corrected properly by maintaining the original entry while adding corrected information? A. Chief Medical Officer. B. Health Information Professional. C. Compliance Officer. D. Quality Manager. Do you know the answer? Correct answer, B. Health information professional. Explanation. Option B is correct because health information professionals ensure proper documentation practices, including error correction procedures that preserve original entries while adding corrections. Option A is incorrect because chief medical officers oversee clinical operations and medical staff, not day-to-day documentation correction procedures and processes. Option C is incorrect because compliance officers ensure regulatory adherence broadly, while health information professionals specifically manage documentation, integrity and corrections. Option D is incorrect because quality managers focus on care quality metrics and outcomes, not specific health record documentation correction procedures. Documentation integrity requires specific expertise and adherence to proper legal procedures. When documentation errors need correction in health records, maintaining the original entry while adding corrected information is crucial, and this responsibility falls to health information professionals. These HIM professionals are the guardians of documentation integrity, trained in legal and regulatory requirements for proper record corrections. The correct process involves drawing a single line through errors, adding corrections with signature and date, never obliterating original entries completely. This preserves the legal integrity of the record and maintains an audit trail of all changes made. This isn't the broad role of chief medical officers or general compliance officers. HIM professionals specifically manage documentation standards. Their specialised expertise ensures corrections meet legal requirements while maintaining the record's evidentiary value for potential future legal proceedings. 21. A hospital needs to determine average daily census for staffing decisions by reviewing the number of patients present at a specific point each day. Which data source provides this? A. Disease Index. B. Daily Census Report. C. Master Patient Index. D. Physician Index. Can you guess the answer? Correct answer, B. Daily Census Report. Explanation. Option B is correct because daily census reports provide the count of patients present at specific times, essential for staffing decisions and resource planning. Option A is incorrect because disease indexes organise records by diagnosis codes for clinical research, not daily patient counting for staffing. Option C is incorrect because the Master Patient Index maintains patient identification information across visits, not daily occupancy counts for planning. Option D is incorrect because physician indexes list cases by provider for credentialing and quality review, not facility census data. Let's explore how healthcare facilities make critical staffing decisions using data analytics. When a hospital needs to determine average daily census for staffing decisions by reviewing the number of patients present at specific points each day, they rely on the daily census report. This report provides the count of patients present at designated times, typically midnight, which is essential for resource planning and staffing allocation. It's not a disease index that organises records by diagnosis, or the Master Patient Index that tracks patient identities across visits. The daily census report gives administrators real-time occupancy data to make informed decisions about nurse-to-patient ratios and resource distribution. This critical operational data ensures adequate staffing levels to maintain quality care while managing costs effectively throughout the facility. 22. When establishing how long newborn records must be retained, considering they need 7 years past the age of majority, which factor primarily determines the requirement? A. State law. B. Physician preference. C. Storage capacity. D. Technology available. Do you know the answer? Correct answer, A. State law. Explanation. Option A is correct because state law establishes legal requirements for record retention periods, including special provisions for minors' records extending past age of majority. Option B is incorrect because physician preferences do not determine legal retention requirements, which are established by law and regulatory standards. Option C is incorrect because storage capacity is a practical consideration, but legal requirements determine mandatory retention periods regardless of space. Option D is incorrect because available technology influences storage methods, but state law determines the required retention period length for records. Record retention requirements for minors involve special legal considerations in healthcare. When establishing how long newborn records must be retained, considering they need 7 years past the age of majority, state law primarily determines these requirements. State law establishes the legal framework for record retention periods, including special provisions for minors that extend well beyond typical adult records. This isn't based on physician preferences or available storage capacity, which are practical considerations but don't determine legal requirements. The age of majority varies by state, typically 18 or 21, meaning newborn records might need retention for 25 to 28 years. Technology available influences how records are stored, but doesn't change the legally required retention period established by state statute. 23. A healthcare facility implements token-based authentication, requiring multiple credentials for accessing electronic health records to prevent unauthorized access. Which governance principle is addressed? A. Availability. B. Retention. C. Protection. D. Disposition. Can you guess the answer? Correct answer, C. Protection. Explanation. Option C is correct because the protection principle focuses on safeguarding information through measures like authentication to prevent unauthorized access, data breaches, and information loss. Option A is incorrect because availability refers to ensuring that information is accessible to authorized users when needed, not the security measures used to restrict access. Option B is incorrect because retention concerns the duration for which records are maintained, not the security protocols for controlling system access. Option D is incorrect because disposition deals with the secure disposal of records that are no longer required, rather than the implementation of authentication tokens for access control. Security measures in healthcare information systems are fundamental to protecting patient data. When a healthcare facility implements token-based authentication, requiring multiple credentials for accessing electronic health records, they're addressing the protection principle of governance. Protection ensures appropriate security levels, including multi-factor authentication methods, to prevent unauthorized access, data breaches, and information loss. This goes beyond simple passwords to include tokens, biometrics, or security codes that create multiple barriers against unauthorized users. It's not about availability, which ensures timely access for authorized users, or retention, which addresses how long records are kept. Protection focuses specifically on safeguarding information through technical controls like authentication tokens. These security layers are essential for maintaining patient trust and meeting regulatory requirements for data security. 24. Medical providers document patient encounters at the point of care using electronic health records that capture information during the actual visit. Which technology enables this? A. Health Information Exchange. B. Electronic Health Record. C. Patient Portal. D. Disease Registry. Do you know the answer? Correct answer, B. Electronic Health Record. Explanation. Option B is correct because electronic health records enable real-time documentation at the point of care, allowing providers to capture information during patient encounters. Option A is incorrect because health information exchanges share data between organizations, not capture documentation during individual patient visits directly. Option C is incorrect because patient portals provide patients access to their records, not provider documentation capabilities during clinical encounters. Option D is incorrect because disease registries collect specific condition data for analysis, not general point-of-care documentation during visits. Point-of-care documentation has revolutionized how providers capture patient information during encounters. When medical providers document patient encounters at the point of care using technology that captures information during the actual visit, they're using electronic health records. Electronic health records enable real-time documentation as care is delivered, allowing providers to enter information while interacting with patients. This isn't a health information exchange that shares data between organizations, or a patient portal that gives patients access to their records. The EHR specifically supports provider documentation during clinical encounters, capturing observations, orders, and treatment plans immediately. This real-time documentation improves accuracy by reducing reliance on memory, ensures completeness of medical records, and makes information immediately available to other care team members. 25. A skilled nursing facility must submit resident assessment data electronically to Centers for Medicare and Medicaid Services using standardized software. Which tool is required? A. Oasis, B. Raven, C. HEDIS, D. UHDS. Can you guess the answer? Correct answer, B. Raven. Explanation: Option B is correct because Raven software is specifically used by long-term care facilities to collect and submit minimum dataset assessment data to CMS electronically. Option A is incorrect because Oasis is the assessment tool for home health agencies, not the software for nursing facility submissions. Option C is incorrect because HEDIS measures managed care plan quality, not the tool for submitting nursing facility assessment data. Option D is incorrect because UHDDS is a hospital discharge dataset, not software for skilled nursing facility assessment submissions. Skilled nursing facilities have specific requirements for submitting resident assessment data to government agencies. When these facilities must submit resident assessment data electronically to Centers for Medicare and Medicaid Services using standardized software, they use Raven. Raven, which stands for Resident Assessment Validation and Entry, is the specific software tool used by long-term care facilities to collect and submit MDS data to CMS. It's not Oasis, which is the assessment tool for home health agencies, or HEDIS, which measures managed care plan quality. Raven ensures standardized data submission from nursing facilities nationwide, supporting quality measurement and reimbursement processes. This software validates data before submission, reducing errors and ensuring compliance with federal reporting requirements for skilled nursing facility assessments. 26. When a physician needs information about hip replacement trends to present to the Chief Financial Officer, which database would provide Medicare patient procedure data? A. Trauma Registry, B. MedPAR, C. Clinical Trials Database, D. Vital Statistics. Do you know the answer? Correct answer, B. MedPAR. Explanation: Option B is correct because MedPAR contains Medicare claims data for acute care and skilled nursing facilities, providing procedure trends for financial analysis. Option A is incorrect because trauma registries focus on injury, data from accidents and violence, not elective procedures like hip replacements. Option C is incorrect because clinical trials databases contain research study information about treatment effectiveness, not Medicare claims and trends. Option D is incorrect because vital statistics track births, deaths, marriages and divorces, not medical procedures or Medicare patient data. Healthcare databases serve specific analytical purposes for different stakeholders in the industry. When a physician needs information about hip replacement trends to present to the Chief Financial Officer, MedPAR provides Medicare patient procedure data. MedPAR, the Medicare Provider Analysis and Review Database, contains comprehensive Medicare claims data for acute care and skilled nursing facilities. This includes detailed procedure information, costs, and outcomes that help analyze trends in surgical procedures like hip replacements. It's not a trauma registry focused on injury data or clinical trials databases that contain research studies. Medipar specifically aggregates Medicare claims, making it invaluable for financial analysis and identifying procedure trends. This database helps administrators understand utilization patterns, costs, and outcomes for Medicare beneficiaries undergoing specific procedures. 27. After identifying potential data security violations, the Health Information Director works with information technology to monitor electronic health record audit trails. Which principle is demonstrated? A. Transparency. B. Integrity. C. Disposition. D. Protection. Can you guess the answer? Correct answer, D. Protection. Explanation: option D is correct because protection involves implementing security measures, including audit trail monitoring, to identify and address potential data security violations proactively. Option A is incorrect because transparency involves documenting processes openly, not monitoring systems for security violations through audit trail reviews. Option B is incorrect because integrity ensures data authenticity and reliability, not monitoring access patterns for potential security breaches identified. Option C is incorrect because disposition addresses proper record destruction when no longer needed, not monitoring for unauthorized access attempts. Proactive security monitoring is essential for maintaining data integrity in healthcare systems. After identifying potential data security violations, when the Health Information Director works with information technology to monitor electronic health record audit trails, they're demonstrating the protection principle. Protection involves implementing security measures, including continuous audit trail monitoring, to identify and address potential violations before they cause harm. Audit trails create a detailed record of who accessed what information and when, providing crucial evidence for investigating suspicious activities. This isn't transparency about documenting processes openly or integrity about data authenticity. It's specifically about protecting data through active monitoring. These audit trail reviews help detect unauthorized access attempts, unusual patterns, and potential insider threats to patient information security. 28. Which method allows providers in rural communities to connect with specialists in urban areas for real-time consultation and patient examination using technology? A. Patient portal. B. Personal health record. C. Telehealth. D. Disease registry. Do you know the answer? Correct answer, C. Telehealth. Explanation: option C is correct because telehealth technology enables remote medical consultations and examinations, connecting rural providers with urban specialists for patient care delivery. Option A is incorrect because patient portals provide patients access to their records and communication with providers, not remote specialist consultations. Option B is incorrect because personal health records are patient-maintained health information tools, not technology for remote provider-to-provider consultation services. Option D is incorrect because disease registries collect condition-specific data for research and quality improvement, not facilitate remote medical consultations. Telehealth technology has transformed healthcare delivery, especially for underserved populations. When providers in rural communities connect with specialists in urban areas for real-time consultation and patient examination, using technology, they're utilizing telehealth services. Telehealth enables remote medical consultations and examinations, bridging the geographic gap between rural providers and urban specialists for collaborative patient care. This isn't a patient portal for accessing records or a personal health record maintained by patients. It's specifically technology for remote clinical services. Through telehealth, specialists can guide examinations, review symptoms, and provide expert consultation without patients travelling long distances. This technology improves access to specialty care, reduces travel burden on rural patients, and enables timely expert consultation for complex medical conditions. 29. A patient has multiple medical record numbers across different departments, causing potential safety issues with conflicting medication information. What type of error is this? A. Overlay. B. Overlap. C. Duplication. D. Mismatch. Can you guess the answer? Correct answer, B. Overlap. Explanation? Option B is correct because overlap occurs when patients have multiple medical record numbers across different databases or departments, creating fragmented records and safety risks. Option A is incorrect because overlay happens when one patient's record is overwritten with another patient's data, not multiple numbers assigned. Option C is incorrect because duplication refers to complete duplicate records for one patient, while overlap involves multiple numbers across systems. Option D is incorrect because mismatch refers to inconsistent data elements, not the specific issue of multiple record numbers across departments. Master patient index errors create serious patient safety risks that must be understood and prevented when a patient has multiple medical record numbers across different departments, causing potential safety issues with conflicting medication information. This represents an overlap error. Overlap occurs when patients have multiple medical record numbers assigned across different databases or departments, creating fragmented and potentially dangerous records. This differs from overlay, where one patient's record overwrites another's data, or simple duplication of complete records. With overlap, different departments might have different medication lists, allergy information, or medical histories for the same patient. This fragmentation can lead to medication errors, missed allergies, and incomplete clinical pictures that compromise patient safety and care quality. 30. An organisation reviews state laws, federal regulations, accreditation standards, and facility policies to establish how long different types of health records must be kept. What is being developed? A. Destruction protocol. B. Retention schedule. C. Storage matrix. D. Compliance plan. Do you know the answer? Correct answer, B. Retention schedule. Explanation: Option B is correct because retention schedules establish timeframes for maintaining different record types based on legal, regulatory, and organisational requirements comprehensively reviewed. Option A is incorrect because destruction protocols specify how to dispose of records, not determining how long different records must be maintained. Option C is incorrect because storage matrices identify where information resides in systems, not the time periods for keeping various records. Option D is incorrect because compliance plans ensure adherence to regulations broadly, while retention schedules specifically address record maintenance timeframes. Developing comprehensive record retention policies requires careful consideration of multiple regulatory sources. When an organisation reviews state laws, federal regulations, accreditation standards, and facility policies to establish how long different types of health records must be kept, they're developing a retention schedule. A retention schedule establishes specific timeframes for maintaining different record types based on all applicable legal, regulatory, and organisational requirements. This isn't a destruction protocol that specifies how to dispose of records or a compliance plan that ensures general regulatory adherence. The retention schedule comprehensively addresses how long each record type must be kept, considering the strictest requirement when multiple regulations apply. This systematic approach ensures legal compliance while managing storage costs and maintaining records for their required useful life. 31. When calculating accounts receivable days, Which two factors directly increase the number of days between service delivery and payment receipt? A. Clean claims and timely filing. B. Bill hold and denied claims. C. Prior authorization and verification. D. Charge capture and coding. Can you guess the answer? Correct answer, B. Bill hold and denied claims. Explanation. Option B is correct because longer bill hold periods and higher denial rates both delay payment receipt, directly increasing accounts receivable days for organisations. Option A is incorrect because clean claims and timely filing actually reduce accounts receivable days by speeding payment, not increasing delays. Option C is incorrect because prior authorization and verification prevent denials up front, potentially reducing rather than increasing receivable days overall. Option D is incorrect because proper charge capture and coding ensure accurate billing, which tends to reduce payment delays, not increase them. Revenue cycle metrics help healthcare organizations identify operational inefficiencies affecting cash flow. When calculating accounts receivable days, longer bill hold periods and higher denial rates both directly increase the number of days between service delivery and payment receipt. Bill hold delays occur when claims aren't submitted promptly after discharge, while denied claims require rework and resubmission, adding significant time to the payment cycle. These factors compound each other, as bills held too long may face additional denials for untimely filing. Unlike clean claims and timely filing that actually reduce receivable days, bill holds and denials are the primary drivers of extended payment cycles. Understanding these relationships helps organizations target specific areas for improvement to accelerate cash flow and reduce accounts receivable days. 32. A hospital information system that combines patient demographic data, clinical documentation, and billing information in one integrated platform represents which architecture model? A. Best-of-breed system. B. Standalone system. C. Integrated system. D. Source system. Do you know the answer? Correct answer, C. Integrated system. Explanation. Option C is correct because integrated systems combine multiple functions, including demographics, clinical documentation, and billing into one unified platform for comprehensive management. Option A is incorrect because best-of-breed systems use separate specialized applications for different functions rather than one integrated platform throughout. Option B is incorrect because standalone systems operate independently without integration, not combining multiple functional areas into one system platform. Option D is incorrect because source systems generate original data but do not necessarily integrate multiple functions into one comprehensive platform. Healthcare information systems architecture determines how different functions work together within an organization. A hospital information system that combines patient demographic data, clinical documentation, and billing information in one integrated platform represents an integrated system model. Integrated systems combine multiple essential functions, including registration, clinical documentation, and financial management into one unified platform for comprehensive healthcare management. This differs from best-of-breed systems that use separate specialized applications for each function, or standalone systems that operate independently. The integrated approach ensures data flows seamlessly between functions without manual transfers or interfaces. This architecture reduces data entry duplication, improves consistency across departments, and provides a complete view of patient information from admission through billing in one system. 33. Which assessment tool must home health agencies use to report patient data electronically to Centers for Medicare and Medicaid Services for reimbursement and quality reporting? A. MDS. B. OASIS. C. Raven. D. UHDDs. Can you guess the answer? Correct answer, B. Oasis. Explanation: option B is correct because OASIS is the standardized assessment tool home health agencies must use for Medicare reporting and reimbursement for adult patients. Option A is incorrect because MDS is the minimum dataset used by skilled nursing facilities, not home health agencies' assessment tool. Option C is incorrect because Raven is software for submitting data, while Oasis is the actual assessment instrument home health uses. Option D is incorrect because UHDDS is the hospital discharge dataset, not the home health assessment tool required by CMS. Home health agencies must use specific assessment tools to meet federal reporting requirements for Medicare beneficiaries. When these agencies report patient data electronically to Centers for Medicare and Medicaid Services for reimbursement and quality reporting, they must use OASIS. OASIS, the Outcome and Assessment Information Set, is the standardized assessment tool specifically required for home health agencies serving adult Medicare patients. It's not MDS, which skilled nursing facilities use, or Raven, which is software for submitting data, not the assessment itself. OASIS captures comprehensive patient assessment data, including functional status, clinical severity, and service utilization for home health patients. This standardized tool enables CMS to measure quality outcomes, determine reimbursement rates, and monitor home health agency performance nationally. 34. When patient records must be produced as evidence in court proceedings, which characteristic determines if the electronic health record will be legally acceptable? A. System certification. B. Legal health record definition. C. Technology platform. D. Storage format. Do you know the answer? Correct answer, B. Legal health record definition. Explanation. Option B is correct because the legal health record definition establishes what constitutes the official record for legal proceedings, determining admissibility in court cases. Option A is incorrect because system certification validates technical capabilities, but the legal health record definition determines evidentiary acceptability in court. Option C is incorrect because the technology platform used doesn't determine legal status. The organization's definition of its legal record does. Option D is incorrect because storage format is less important than having clearly defined legal health record policies for court admissibility. Legal health records must meet specific requirements to be admissible as evidence in court proceedings. When patient records must be produced as evidence, the organization's legal health record definition determines if the electronic health record will be legally acceptable. The legal health record definition establishes what constitutes the official business record for legal proceedings, determining admissibility in court cases. It's not about system certification or technology platforms, but rather the organization's formal designation of what comprises its legal record. This definition must consider federal and state laws, include a comprehensive inventory of record locations, and specify which versions are considered official. Without a clear legal health record definition, organizations face challenges defending the authenticity and completeness of records in legal proceedings. 35. A credentialing officer needs to verify a physician's history of malpractice payments and adverse licensure actions before granting hospital privileges. Which database should be accessed? A. Medlin. B. National Practitioner Databank. C. Trauma Registry. D. Clinical Trials Database. Can you guess the answer? Correct answer, B. National Practitioner Databank. Explanation. Option B is correct because the National Practitioner Databank maintains records of malpractice payments and adverse actions essential for credentialing verification processes. Option A is incorrect because Medline contains biomedical literature and research publications, not practitioner credentialing or malpractice payment information databases. Option C is incorrect because trauma registries collect injury data for quality improvement, not physician credentialing or professional conduct records. Option D is incorrect because clinical trials databases contain research study information, not practitioner licensing or malpractice payment history data. Physician credentialing requires thorough verification of professional history before granting hospital privileges. When a credentialing officer needs to verify a physician's history of malpractice payments and adverse licensure actions, they must access the National Practitioner Data Bank. The National Practitioner Data Bank maintains comprehensive records of malpractice payments, adverse licensure actions, and professional review actions essential for credentialing verification. It's not Medline, which contains medical literature, or trauma registries that track injury data for quality improvement. The NPDB serves as a centralised repository where healthcare entities must report and can query practitioner information. This database helps prevent practitioners with problematic histories from simply moving to new locations without disclosure, protecting patients through comprehensive background verification. 36. An acute care hospital implements computerized physician order as entry, requiring providers to enter all orders electronically, including medications, tests, and consultations. What does this improve? A. Revenue cycle only. B. Patient safety primarily. C. Documentation speed only. D. Storage capacity mainly. Do you know the answer? Correct answer, B. Patient safety primarily. Explanation. Option B is correct because CPOE primarily improves patient safety by reducing medication errors, ensuring order legibility, and providing decision support during ordering. Option A is incorrect because while CPOE may help billing accuracy, its primary purpose is patient safety through error reduction mechanisms. Option C is incorrect because documentation speed is a benefit, but the main goal is reducing errors and improving safety outcomes. Option D is incorrect because storage capacity relates to record retention and space, not the safety benefits of computerized order entry. Computerized physician order entry systems have transformed medication safety in healthcare facilities. When an acute care hospital implements CPOE requiring providers to enter all orders electronically, including medications, tests, and consultations, the primary improvement is patient safety. CPOE primarily enhances patient safety by reducing medication errors through legible orders, clinical decision support, and automatic checking for drug interactions and allergies. While it may help revenue cycles and documentation speed, the fundamental purpose is preventing errors that could harm patients. The system eliminates handwriting interpretation errors, provides real-time alerts for dangerous drug combinations, and ensures complete orders with all required elements. Studies show CPOE can reduce medication errors by more than 50%, making it a critical patient safety technology. 37. Which data characteristic is compromised when a patient's admitting diagnosis of pneumonia changes to heart failure by discharge, affecting report accuracy if not updated? A. Currency. B. Granularity. C. Precision. D. Definition. Can you guess the answer? Correct answer. A. Currency. Explanation. Option. A is correct because currency ensures data remains current and updated, as diagnoses often change during hospitalization, requiring updates for accurate reporting. Option B is incorrect because granularity refers to the level of detail that cannot be further subdivided, not updating changing clinical information. Option C is incorrect because precision relates to numerical exactness in measurements, not keeping diagnostic information current throughout the stay. Option D is incorrect because definition provides clear meanings for terms, while currency addresses keeping information updated as conditions change. Data currency is a critical quality characteristic that affects the accuracy of healthcare reporting and decision-making. When a patient's admitting diagnosis of pneumonia changes to heart failure by discharge, this affects report accuracy if not updated, demonstrating issues with currency. Currency ensures data remains current and reflects the most recent accurate information throughout the patient's stay. Diagnoses often evolve as testing reveals the true condition, making currency essential for accurate clinical and administrative reporting. This isn't about granularity, which addresses level of detail, or precision, which relates to numerical exactness in measurements. Without maintaining currency, reports would show incorrect diagnoses, affecting quality metrics, reimbursement, and clinical research. Healthcare providers must continuously update diagnoses and other clinical data to maintain currency throughout the care episode. 38. When implementing encryption for backup tapes containing protected health information, which aspect of information security is primarily being addressed to prevent breaches? A. Authentication. B. Authorization. C. Confidentiality. D. Availability. Do you know the answer? Correct answer, C. Confidentiality. Explanation. Option C is correct because encryption protects confidentiality by making data unreadable to unauthorized persons if backup tapes are lost or stolen during transport. Option A is incorrect because authentication verifies user identity for system access, not protecting data on backup media through encryption methods. Option B is incorrect because authorization determines access permissions for users, while encryption protects the actual data from unauthorized viewing. Option D is incorrect because availability ensures data accessibility when needed, while encryption specifically protects data confidentiality on backup media. Protecting backup media is essential for maintaining data security, even when information leaves the primary facility. When implementing encryption for backup tapes containing protected health information, the primary security aspect being addressed is confidentiality. Encryption protects confidentiality by transforming data into unreadable code that only authorized parties with decryption keys can access. If backup tapes are lost or stolen during transport or storage, encrypted data remains protected from unauthorized viewing. This isn't about authentication, which verifies user identity, or availability, which ensures data accessibility when needed. Encryption specifically safeguards the confidentiality of information on portable media. This protection is crucial because backup tapes often travel off-site and could be intercepted, making encryption the last line of defense. 39. A healthcare organization develops written procedures for detecting identity theft indicators in daily operations and training staff to recognize potential fraud. Which regulation requires this? A. HIPAA privacy rule. B. Red flags rule. C. Security rule. D. Breach notification. Can you guess the answer? Correct answer, B. Red flags rule. Explanation. Option B is correct because the red flags rule requires organizations to implement written programs detecting identity theft warning signs in day-to-day operations. Option A is incorrect because the privacy rule governs protected health information use and disclosure, not identity theft prevention program requirements. Option C is incorrect because the security rule addresses electronic PHI safeguards, not specific identity theft detection program requirements for organizations. Option D is incorrect because breach notification requires reporting unauthorized disclosures, not implementing identity theft prevention programs detecting red flags. Identity theft prevention has become a critical compliance requirement for healthcare organizations handling sensitive information. When an organization develops written procedures for detecting identity theft indicators in daily operations and training staff to recognize potential fraud, they're following the red flags rule. The red flags rule specifically requires organizations to implement written programs that detect warning signs of identity theft in day-to-day operations. This isn't the HIPAA privacy rule about information disclosure or the security rule about electronic safeguards for protected health information. The red flags rule mandates that covered entities identify relevant red flags, detect them when they occur, respond appropriately to prevent harm, and update their program periodically. Healthcare organizations must train staff to recognize suspicious activities like address changes followed immediately by insurance card requests. 40. Which professional typically serves on the Data Governance Steering Committee to represent clinical documentation needs and ensure physician engagement in data quality initiatives? A. Chief Financial Officer. B. Chief Medical Officer. C. Compliance Officer. D. Security Officer. Do you know the answer? Correct answer, B. Chief Medical Officer. Explanation. Option B is correct because Chief Medical Officers represent clinical perspectives on data governance committees, ensuring physician engagement and clinical documentation quality considerations. Option A is incorrect because Chief Financial Officers focus on financial data and revenue cycle, not clinical documentation and physician engagement primarily. Option C is incorrect because compliance officers ensure regulatory adherence broadly, while medical officers specifically represent clinical documentation needs effectively. Option D is incorrect because security officers focus on data protection and access controls, not clinical documentation quality and physician engagement. Data governance committees require diverse representation to ensure all perspectives are considered in decision-making. When selecting professionals to serve on the Data Governance Steering Committee to represent clinical documentation needs and ensure physician engagement, the Chief Medical Officer is the ideal choice. The Chief Medical Officer brings clinical expertise and physician leadership to data governance, ensuring medical staff perspectives are represented in data quality initiatives. They understand clinical workflows, documentation challenges physicians face, and can effectively communicate governance decisions back to medical staff. This isn't the Chief Financial Officer's role focusing on financial data, or the Compliance Officer's broad regulatory focus. The CMO specifically bridges the gap between administrative governance and clinical practice, ensuring data governance decisions support rather than hinder patient care delivery while maintaining physician buy-in. 41. During qualitative analysis of health records, reviewers examine documentation to ensure it meets facility policies, regulations, and accreditation standards for content quality. When is this performed? A. Only at admission. B. During patient stay. C. After discharge only. D. Before billing only. Can you guess the answer? Correct answer, C. After discharge only. Explanation. Option C is correct because qualitative analysis, reviewing documentation quality against standards, typically occurs retrospectively after discharge during closed record review processes conducted systematically. Option A is incorrect because admission focuses on obtaining initial documentation and consents, not comprehensive qualitative analysis of record quality. Option B is incorrect because concurrent review during stays focuses on completeness, while qualitative analysis comprehensively reviews after discharge typically. Option D is incorrect because billing review ensures charges and codes are correct, while qualitative analysis examines overall documentation quality standards. Quality analysis of health records involves systematic review processes to ensure documentation meets established standards. During qualitative analysis, reviewers examine documentation to ensure it meets facility policies, regulations, and accreditation standards for content quality, typically performed after discharge only. This retrospective review, called closed record review, occurs after the patient has been discharged and the record is complete. It's not done at admission when documentation is just beginning, or during the stay when concurrent review focuses on completeness rather than quality. Qualitative analysis after discharge allows comprehensive evaluation of the entire care episode, checking if documentation tells a coherent clinical story. This timing ensures reviewers can assess whether all regulatory requirements were met, clinical decisions were properly documented, and the record accurately reflects the care provided throughout the entire hospitalization. 42. A small rural hospital participates in a health information exchange where each facility maintains its own data but shares through a record locator service. Which model is this? A. Centralized. B. Federated. C. Direct. D. Hybrid. Do you know the answer? Correct answer, B. Federated. Explanation: option B is correct because federated models use record locator services to identify where patient data resides, while each participant maintains their own data storage. Option A is incorrect because centralized models store all data in one shared repository, not maintaining separate storage with locator services. Option C is incorrect because direct exchange involves point-to-point sharing between known parties, not using record locator service architecture models. Option D is incorrect because hybrid combines central storage with distributed elements, while federated keeps all data distributed using locators only. Health information exchange models determine how patient data is stored and accessed across multiple healthcare organizations. When a small rural hospital participates in an exchange where each facility maintains its own data, but shares through a record locator service, this represents a federated model. The federated model, also called decentralized, uses a record locator service to identify where patient data resides, while each participant maintains their own data storage systems. This differs from centralized models where all data goes into one repository, or direct exchange involving point-to-point sharing between known parties. In federated models, when a provider needs patient information, the record locator service identifies which participating organizations have relevant data. The provider can then access that information from the source systems directly, maintaining local control while enabling regional data sharing for coordinated care. 43. Which document type requires physician authentication and must include findings, specimens removed, and post-operative diagnosis immediately after surgical procedures are completed? A. Progress note. B. Operative report. C. Consultation. D. Discharge summary. Can you guess the answer? Correct answer, B. Operative report. Explanation: option B is correct because operative reports document surgical procedures, including findings, specimens removed, and post-operative diagnosis, requiring timely physician authentication after surgery. Option A is incorrect because progress notes document ongoing patient status and treatment response, not specific surgical procedure details and findings. Option C is incorrect because consultations provide specialist opinions and recommendations, not documentation of surgical procedures performed and specimens removed. Option D is incorrect because discharge summaries provide overall hospitalization information at discharge, not immediate post-surgical procedure documentation requirements. Surgical documentation requires specific elements to meet regulatory and legal requirements for procedural records. When documenting surgical procedures, the operative report must include findings, specimens removed, and post-operative diagnosis, requiring timely physician authentication after surgery is completed. The operative report is the official documentation of what occurred during surgery, including detailed descriptions of the procedure performed, any unexpected findings, and specimens sent to pathology. This isn't a progress note documenting ongoing care or a consultation providing specialist opinions. It's specifically the surgical procedure documentation. The operative report must be dictated or written immediately after surgery, with a brief operative note required if the full report is delayed. This timely documentation ensures critical surgical information is available for post-operative care decisions and meets accreditation requirements. 44. To calculate the case mix index, which two data elements must be collected for every inpatient discharge to perform the required calculation. A. Length of stay and charges. B. DRG weight and discharge count. C. Diagnosis codes and procedures. D. Admission source and status. Do you know the answer? Correct answer, B. DRG weight and discharge count. Explanation. Option B is correct because case mix index calculation requires summing all DRG weights, then dividing by the total number of discharges for the period. Option A is incorrect because length of stay and charges don't directly calculate case mix index, which uses DRG weights and volumes. Option C is incorrect because while codes determine DRG assignment, the calculation specifically uses assigned DRG weights and discharge counts directly. Option D is incorrect because admission source and discharge status affect other metrics, but case mix index uses DRG weights and counts. Case mix index calculations provide insights into the complexity and resource intensity of a hospital's patient population. To calculate the case mix index, you must collect the DRG weight and discharge count for every inpatient discharge, then perform a specific calculation. The formula involves summing all DRG weights for the period, then dividing by the total number of discharges to get the average weight. This isn't about length of stay and charges, which measure different aspects of utilisation, or just diagnosis codes that determine DRGs. The DRG weight reflects the expected resource consumption for each patient type, while the discharge count provides the volume. A higher case mix index indicates a more complex patient population, requiring more resources, affecting staffing needs, budget planning, and reimbursement expectations for the facility. 45. When defining the legal health record, organisations must consider federal rules of evidence and create a matrix identifying all locations where health information resides. This ensures what? A. Billing accuracy. B. Quality reporting. C. Legal admissibility. D. Research validity. Can you guess the answer? Correct answer, C. Legal admissibility. Explanation. Option C is correct because defining the legal health record following federal rules of evidence ensures records will be admissible in legal proceedings when required. Option A is incorrect because billing accuracy depends on charge capture and coding, not a legal health record definition for court admissibility. Option B is incorrect because quality reporting uses clinical data for metrics, while legal health record definition addresses evidentiary requirements specifically. Option D is incorrect because research validity depends on data quality and methodology, not legal health record definitions for court proceedings. The legal health record must be carefully defined to ensure its admissibility in legal proceedings and court cases. When defining the legal health record, organisations must consider federal rules of evidence and create a matrix identifying all locations where health information resides to ensure legal admissibility. Legal admissibility means the record will be accepted as evidence in court, meeting requirements for authenticity, reliability, and trustworthiness under federal evidence rules. This isn't about billing accuracy for reimbursement or quality reporting for performance metrics. It's specifically about meeting evidentiary standards. The matrix helps identify all components of the legal record across paper and electronic systems, ensuring nothing is missed when records are subpoenaed. Without proper definition following federal rules of evidence, healthcare organizations risk having their records rejected as evidence in malpractice cases or other legal proceedings. 46. A patient provides written authorization for releasing records to their attorney for a malpractice case after the facility verifies the attorney's identity and credentials. Which aspect is critical? A. Payment verification. B. Medical necessity. C. Identity verification. D. Insurance coverage. Do you know the answer? Correct answer, C. Identity verification. Explanation: option C is correct because identity verification of the requesting party is critical before releasing protected health information to ensure records go to authorized recipients. Option A is incorrect because payment verification relates to billing and reimbursement processes, not requirements for releasing records to attorneys. Option B is incorrect because medical necessity determines treatment appropriateness for payment, not requirements for legal record release authorization processes. Option D is incorrect because insurance coverage affects payment for services, not the requirements for verifying identity before record release. Release of information procedures must include strict verification protocols to protect patient privacy and ensure authorized disclosure. When a patient provides written authorization for releasing records to their attorney for a malpractice case, identity verification of the requesting party is critical before release. Identity verification ensures the person receiving protected health information is actually who they claim to be, preventing unauthorized disclosure to imposters. This isn't about payment verification for services or medical necessity for treatment. It's specifically about confirming the requester's identity. The facility must verify the attorney's identity through credentials, bar number, letterhead, or direct contact with the law firm. This verification step protects patients from identity theft and facilities from HIPAA violations. Without proper identity verification, sensitive medical information could be released to unauthorized individuals posing as legitimate requesters. 47. Which technology enables physicians to monitor patients' heart rhythms remotely through devices that transmit physiological signals for continuous cardiac surveillance outside hospital settings? A. Patient portal. B. Patient wearable device. C. Electronic health record. D. Health information exchange. Can you guess the answer? Correct answer, B. Patient wearable device. Explanation: option B is correct because patient wearable devices, like cardiac monitors, transmit physiological signals remotely, enabling continuous monitoring of heart rhythms outside healthcare facilities. Option A is incorrect because patient portals provide record access and communication features, not continuous physiological signal monitoring capabilities for patients. Option C is incorrect because electronic health records document care within facilities, not provide remote continuous physiological monitoring through wearable devices. Option D is incorrect because health information exchanges share data between organizations, not monitor physiological signals through patient-worn monitoring devices. Remote patient monitoring has revolutionized how healthcare providers track patients' conditions outside traditional clinical settings. When physicians need to monitor patients' heart rhythms remotely through devices that transmit physiological signals for continuous cardiac surveillance, they use patient wearable devices. Patient wearable devices like cardiac monitors, smartwatches, or implanted sensors continuously collect and transmit physiological data, including heart rhythm, rate, and other vital signs. This isn't a patient portal for viewing records or an EHR for documentation. It's specifically technology worn by patients that monitors their body's signals. These devices enable 24-hour surveillance of cardiac patients at home, alerting providers to dangerous arrhythmias or other concerning patterns immediately. This continuous monitoring improves outcomes by detecting problems early, reduces hospitalizations, and allows patients to maintain normal activities while being medically supervised. 48. When a physician fails to complete medical records within required timeframes resulting in delinquent status, which committee typically reviews this issue during regular meetings? A. Finance Committee. B. Medical Staff Committee. C. Board of Directors. D. Ethics Committee. Do you know the answer? Correct answer, B. Medical Staff Committee. Explanation: option B is correct, because medical staff committees oversee physician documentation compliance, including review of delinquent records reported by health information management departments regularly. Option A is incorrect because finance committees focus on budgets and financial performance, not physician documentation completion and delinquency issues directly. Option C is incorrect because boards of directors oversee overall governance, while medical staff committees specifically handle physician documentation issues. Option D is incorrect because ethics committees address moral and ethical dilemmas in patient care, not routine documentation completion requirements. Medical staff governance structures ensure physician accountability for documentation compliance in healthcare facilities. When physicians fail to complete medical records within required timeframes resulting in delinquent status, the Medical Staff Committee typically reviews this issue during regular meetings. The Medical Staff Committee oversees physician documentation compliance, reviewing delinquent record reports from health information management, and taking corrective actions when necessary. This isn't the Finance Committee's focus on budgets or the Board of Directors' overall governance role. It's specifically medical staff self-governance. These committees establish bylaws governing record completion, review monthly delinquency rates, and can suspend admitting privileges for chronic offenders. The HAM director typically presents delinquency data at these meetings, identifying physicians with incomplete records. This peer review process ensures physician accountability for timely documentation while maintaining professional autonomy. 49. A facility evaluates whether to keep records electronically versus paper, considering long-term accessibility needs for records that must be retained for extended periods. Which format provides best long-term access? A. Microfilm. B. Paper files. C. Electronic health record. D. Scanned images. Can you guess the answer? Correct answer, C. Electronic health record. Explanation: option C is correct because electronic health records provide optimal long-term accessibility through rapid retrieval, search capabilities, and durability compared to physical media degradation. Option A is incorrect because microfilm requires special readers and degrades over time, making long-term access more difficult than electronic systems. Option B is incorrect because paper files deteriorate, require physical storage space, and are difficult to search compared to electronic records. Option D is incorrect because while scanned images digitize records, full electronic health records provide better functionality for long-term access needs. Long-term data storage decisions must balance accessibility needs with practical considerations for extended retention periods. When evaluating storage formats for records that must be retained for extended periods while maintaining accessibility, electronic health records provide the best long-term access. Electronic health records offer optimal accessibility through rapid search capabilities, instant retrieval, and immunity from physical degradation that affects paper and film media. Unlike microfilm requiring special readers, or paper files that deteriorate and require physical storage space, electronic records remain consistently accessible. Scanned images digitize paper, but lack the full functionality of native electronic records with structured data. Electronic storage enables keyword searches, remote access, and automated backup protection against loss. As technology advances, data migration ensures continued accessibility, while physical media becomes increasingly obsolete and difficult to access over decades. 50. Which situation requires immediate notification to affected individuals under breach notification requirements? When protected health information is inappropriately accessed without authorization. A. Encrypted data loss. B. Good faith access. C. Unsecured data breach. D. Limited data set. Do you know the answer? Correct answer, C. Unsecured data breach. Explanation: option C is correct because unsecured data breaches involving unencrypted, protected health information require immediate notification to affected individuals under HIPAA breach notification rules. Option A is incorrect because encrypted data loss doesn't require notification if encryption meets standards, as data remains protected from viewing. Option B is incorrect because good faith access by employees within the scope of their work doesn't constitute a breach requiring individual notification processes. Option D is incorrect because limited data sets have identifiers removed for research, and their use doesn't automatically require breach notifications. HIPAA breach notification requirements establish clear protocols for responding to unauthorized access to protected health information. When protected health information is inappropriately accessed without authorization, immediate notification to affected individuals is required for unsecured data breaches. An unsecured data breach involves unencrypted, protected health information that has been accessed, used, or disclosed in violation of privacy rules. This triggers mandatory notification requirements to individuals, the Department of Health and Human Services, and potentially the media for large breaches. Encrypted data loss doesn't require notification if encryption meets standards, and good faith access by employees within their scope doesn't constitute a breach. The notification must occur without unreasonable delay, no later than 60 days after discovery, explaining what happened, what information was involved, and steps individuals should take. These requirements ensure transparency and allow affected individuals to protect themselves from potential harm. You have reached the end of our first question set. For the free complete exam preparation, visit our website link in the description, where you find thousands more practice questions and comprehensive study guides. Thanks for studying with us today. See you in the next video.